Hello and welcome to this course on how to double your dentistry. My name is Andrew Schultz and I am the Director of Business Development with Midmark Animal Health. Dr. Cindy Charlier and I are going to tell you about our groundbreaking study and share the secrets of success for your dental practice. In this course, we are going to describe a study that we did at Midmark Animal Health. This was the first ever study in veterinary medicine on the components of developing a successful dentistry program. I will be providing an introduction about the benefits of this program you can recognize upon completion. The program training is developed under the guidance and expertise of Dr. Cindy Charlier.
Let us discuss in more detail why this subject is important. Veterinary dentistry is the largest untapped source of patient care and practice growth in most small animal practices. Recent studies have shown that up to 80% of cats and dogs over the age of 3 have periodontal disease that goes untreated. This means that probably 90% of the patients in your practice that have periodontal disease are going home without proper treatment and continue to suffer. As the leading provider of capital equipment to companion animal veterinary hospitals, Midmark Animal Health conducted a study to determine the key ingredients necessary to develop a successful dentistry program. Our goal was to develop a recipe for success and provide case studies to support our return on investment claims when selling equipment. We hypothesized that dentistry and oral surgery was largely untapped, and with the proper equipment, training, and tools, most practices would see a significant return on their investment in the dentistry portion of their practice. We will present our findings, which supported our hypothesis and exceeded our expectations. The goals of the study were to promote comprehensive dentistry services, improve patient care, increase compliance, increase dentistry procedures, and increase revenue and profits.
Let's look at our study dubbed Project Milkbone. Project Milkbone had 5 stages: select, measure, equip, train, and improve. Click each stage to learn about them.
Let's look a little closer at the clinics we chose. We selected 5 multiple doctor practices that had an interest in improving their dentistry. They were all performing at the industry benchmarks in terms of dentistry as a % of practice revenue. The hospitals were all fairly well-managed practices, and 4 out of 5 were AAHA accredited. They were all suburban hospitals, but after that they were slightly different. They served different demographics, were of different sizes, and had varying number of patients. They all shared a desire to learn and get better, and that proved to be an important component. In terms of the percentage of total revenue they were earning, they were right in line with the industry averages. And what we've discovered is that bar is really low. It could be a lot more than that. As we implemented this program and began to track their success, they more than doubled their dental revenue in the first 12 months, and that's just an average.
As a result of the newly designed dentistry program that included upgraded equipment, training for the entire staff, marketing materials and support, and ongoing coaching, the clinics experienced tremendous gains in their productivity as measured by dental revenue per full-time equivalent doctor. As a group, they started slightly above the top industry benchmarks, but as they implemented their program, gained confidence with more experience, and continuously improved their processes and standards of care, their average productivity in the first 12 months was almost 3 times that of when they began. Because this is an average over 12 months, they were even more productive in month 12. Some were almost 5 times as productive as the average AHA clinics. When we looked at return on investment, they beat their baseline on average by $75,000. The top 100 they beat by $82,000, and the AHA accredited hospitals were beat by almost $100,000 in incremental revenue in year 1. With an average retail cost of $21,000 for new dental equipment, X-ray and high speed, they would have paid back their investment in a matter of a few months. But the benefits didn't stop. In fact, the first clinic clocked $250,000 in incremental revenue by their 20th month.
So what were the 5 keys to success? They are owner commitment, equipment, training, client education and marketing, and continuous improvement.
Now that you are familiar with Project Milkbone and the phenomenal success experienced by the study clinics, I invite you to continue on with our 1-hour Double Your Dentistry course. With the help of Dr. Cindy Charlier and our study clinics, we will take you through each of the 5 keys to success in detail so you can begin your journey to transform your practice and double your dentistry.